hear us. So thank you so much for joining today's webinar. My name's Kate. I'm the Community Engagement and Events Coordinator for IHMRI. And due to COVID-19, like a lot of organisations, we have taken our events online. So I'm really thrilled that you've been able to join us. I'm sure you're all familiar with how webinars work, but if you have any comments that you'd like to make, or if you have any tech issues, then just pop that in the Zoom webinar chat, which is on your right-hand side. And if you have any questions specifically that you'd like to ask Yasmine around nutrition and MS, then if you could please pop those in the Q&A section. Just at the bottom of your screen, you'll see Q&A and a couple of speech bubbles. If you pop any questions you have in there, and we will do our best to get to those during the webinar. So I'll introduce you properly to Yasmine in just a second. But first, for those of you who don't know, IHMRI stands for the Illawarra Health and Medical Research Institute. We're a not-for-profit charity, and our goal is to support health and medical researchers in the Illawarra, Shoalhaven region of New South Wales. Our primary goal is to bring scientists, doctors and health professionals together to help to solve our greatest health challenges, and in particular health challenges that face us in our region. So Yasmine, Associate Professor Yasmine Probst is a senior researcher and an IHMRI affiliated researcher. She's a senior lecturer at the University of Wollongong and a research fellow with IHMRI. She's recognised as an advanced accredited practicing dietitian with the Dietitians Association of Australia and a fellow of the Australasian College of Health Informatics. She's the Honours Coordinator for Nutrition and Dietetics at the University of Wollongong and Coordinator of the Visiting Researcher Programme for the Smart Foods Centre. Yasmine was diagnosed with MS in 2004, and she's here today to tell us a bit about her personal journey with MS and how this has impacted her research. So welcome Yasmine, and over to you. Can you just tell us a little bit more about yourself? Oh, just unmute.
First and foremost, I need to unmute my microphone. That's the most important thing for a webinar.
That is important.
Yes, definitely. So I guess the main thing for me is that when I think about myself, I don't think about myself as a person who has MS. That's the main thing that I would like people to have a bit of a think about today as well. For those who are online and have MS, or for those who are online and care for people with MS or are carers or friends of, I don't think that's a defining factor for us. I believe it's really just one element in who we are, and we're all quite unique in very different ways. So for example, for me, I like to think of myself probably first and foremost as a mum. You know, I've got 3 beautiful children, 3 within 3 years, so a little bit crazy on that front. But also I wouldn't change that for the world. I mean, it's just what makes of life at the moment. And as part of that journey of being a mum, I'm also a busy soccer mum and a manager for soccer as well. So lots of things that don't mean that I'm a person with MS and limited to what I have to do. As Kate already said, I'm a dietitian, so I've got advanced credentials in dietetics. I'm an academic, a scientist, a wife, sister, daughter, auntie, you know, all of those usual criteria. But then down the bottom of the list, I'd probably say yes. And I also happen to have MS. I've had MS since 2004. So I'm actually coming up to my 16-year anniversary of diagnosis on the 15th of December. And the reason why that date sticks in my head is because it was actually right in the middle of my PhD. So I had just finished recruiting and was busy about to go out to visit sites, and boom, everything hit. So I was one of those people that was burning the candle at both ends, and obviously that extra factor of stress from all elements of everything going on at the time didn't help the case. But in terms of the diagnosis, I was relatively lucky because for some people, I know it takes years to be diagnosed with MS and to have that confirmed diagnosis. And I was actually, you know, confirmed quite quickly. So I had numbness in my hands and in my feet, and that was slowly creeping up my legs, almost up to my knees. And at that point I thought, oh, I probably should get this checked out, you know, as per usual, trying to ignore things. You know, early 20s, I was trying to live life as you do in your 20s. So no, I went to the doctor and they said, no, off to hospital. We need to get this checked out more carefully because we don't think this is just something that'll go away. So for me in hospital, it was then a case of lots of tests. So a good old lumbar puncture, which for those who've been diagnosed can probably relate to, MRI scans, the works. But thankfully, those criteria plus a previous clinical case of where I had been seeing flashes of light, and this was about 2 or 3 years prior, and that had been put down to who knows what that is, we'll just park that. But because of those two factors, they were seen to be neurological, so the tingling in my feet and hands, plus then the flashes of light, that formed my diagnosis of MS. Plus, of course, they could see lesions on my brain already. So it was relatively clear in terms of what it was. And it took me a little while to come to grips with that. But as part of that as well, I think my realization of the fact that I can manage my disease as well was really quite important.
Thanks, Yasmine. So you had a diagnosis in 2004. You're in the middle of your PhD and doing research. Can you tell us a little bit more about the research that you were doing then and what you're doing now?
Yeah, sure. So at the time I was researching different ways that we can assess diet, so what we eat, using different tools. So my PhD created a different tool that was online. It was quite cutting edge and amazing at the time. Now it's just another tool that's online, but back then it was a big deal. And I've then taken a bit of a shift in direction because of the fact that there are so many lifestyle factors now that are influencing MS. I've moved a lot of my research across from the learnings that I've had early on. So in terms of the tool development and some of the other research things that I had done, like clinical trial research and so forth. And I've moved those now into a specific focus on MS and diet. It was just something that it felt right. And it took me a long time to get to that feeling of it feeling right as well. So I mentioned 16 years since diagnosis. I'd say it probably took me a good 10 years just to come to the realization that I'm just like everyone else. I'm not different. I haven't been pigeonholed as a person who has a disease. There are lots of people out there who are quite similar. And even though MS is such a unique disease, it's not something that has to control us. We can control it. And I think the idea that I was both someone who has a chronic condition, but then also wore that hat of being a health professional, I thought, I've got something here that I can give back. I can actually help people who may not have that understanding of nutrition and how to eat properly and may not have that scientific grounding to what they do. You know, it was a big driver for me in terms of where I was moving my research to. And that's been the case for a number of years now. As I've moved on, it's just been amazing.
So it sounds like your diagnosis helped to steer your direction of research.
It really did. Yes, it definitely did. Unbeknown to me at the time, I mean, that was in the middle of the original research program that I was working on. And now many years later, I've defined my own research program and I love it.
So just talking about research, I know a lot of questions that come up for researchers is a question of funding. Can you tell us a little bit about how your research in particular is funded?
Sure. So back to those early days, I was lucky enough to receive quite a few bouts of government funding. So I was on research only funding, which was beautiful. I had all of my time focused on just the research. And
so that means that you didn't have to do any teaching.
Exactly. And it was great because it really meant I could push the area that I was moving in and moving to quite quickly. Whereas now I'm on a continuing appointment with the university, and I do actually have to do a fair bit of teaching and governance, so a bit of admin work in there as well. And it does take up a fair amount of time. I mean, I love that part of my job, but in the ideal world, I would love to go back to being research only and have that dedication to just focusing in on the research, in particular in areas like diet and MS, where there's so little out there at the moment. I feel that having that focus and that dedication would be ideal. I mean, what I was saying about the teaching, part of the teaching is also then encouraging our students and working with research students to train them in the area. And over the last few years, I've had quite a few students on board who I've worked with on various projects. And in particular, we've just had some students present some work that was MS related. And I'd actually like to share some of that with you guys, if you don't mind.
That would be great.
I'll go back to sharing my screen in just a moment. Hopefully you can all see my screen share once it does pop up. I'm working across a number of different screens, so just bear with me here as well. Okay. Should start to share pretty soon. Can you see that?
Yeah, we can see that.
Fabulous.
Just maximize the screen. Will be perfect. Great.
Okay. So for those of you who have got MS or working with people with MS, you may be aware that nutrition is a way to take that self-control back. And one of the things that we're really finding in the research that we've been doing is that people make lots of dietary changes quite early on. So following diagnosis is, what can I do? Everyone that we've spoken to recently, they're reading up on what is MS, what can we do, what can we change? So lots of different lifestyle factors that become different to what they used to be. And there are lots of people in particular who make dietary changes. And the challenge that we're finding though with some of those dietary changes is there's nothing that's really consistent in the space of MS and diet at the moment. There's a lot of misinformation, I'll have to say, out there that's being presented to people in a very convincing way. But at the same time, there's also a lot of information that's quite credible, but it's hidden away and it's not put to the forefront quite as much. So what we were doing is we had a project this year, funnily enough, where we were talking to people who have MS and also to health professionals to see what their thoughts were on some nutrition information that we had been creating over the years. So we had looked at the studies that are out there to see what was published, what was really strong in terms of the support for that area, but then also what did the people on the ground think? So what did those who would be impacted by the messages actually think about these ones that we had created? And I'll share some of the thoughts that came through from some of that with you. So we found that there was actually quite a big difference. So we found a few key themes that came through, but those changes in diet that I spoke about just before really came through as a result of that uncertainty of MS, because it's such a unique disease. For those of us here who've got it, you know that one day is not the same as the next, and you can't predict the future of this disease. So changing the diet was a way to take control, and it was a way to work out what can we do to better ourselves. And that was a really positive finding that we were hearing from people. But in that same space, we were also finding that people who had been diagnosed were thinking, I don't know if diet is the right thing to look at. Is it really the best approach to managing my disease? And they were then starting to look a little bit more into the area and do a lot more reading in the area. And that's where we found the difference from the skeptic to the believer. So they started to test the waters a little bit and make some slow changes to their diet. And they were realizing the positive impact that it was having on their health, both in terms of their mood, but then also on some of their symptoms as well. And that was really quite exciting to hear about. But the thing that we found that was really the most fascinating was the unique journey of MS that was really expressed by a number of different people. And I'll touch on this a little bit further on this next slide with you all. So what was happening here is we were seeing that people were looking at the diets, and I say that in inverted commas because there are some that are approaches that may not be beneficial from a nutrition perspective. So they were looking at these particular diets and comparing their own eating pattern with what these are recommending. And then it came down to a bit of interpretation of what is the information telling me? How does this make sense to me? And do I agree with what this is suggesting that we should be doing? So there was a very big interpretation of information going on there, and it was a very personal interpretation of information. And we were finding that there was a bit of a disconnect between the acceptance and the dismissal of some of the diets that were out there. So for those who have MS, you probably have heard of a few of the diets, and I'm not going to name names in particular, but there are some very strong candidates out there who are pushing some very strong messages in our direction. And we were seeing that from talking to people that there was a lot of agreement or disagreement. So it didn't tend to be that there were people sitting on the fence. It was one end or the other. It was very extreme. And I guess that's a bit of an insight. But what we were seeing there as well was that there was a bit of a hierarchical scale of what was happening to people as they were going through their own journey with multiple sclerosis. So we were seeing that the idea of intervening with the diet or with making changes of what you're eating was a bit of a coping mechanism. So this is something that you can do yourself, and I've done it myself as well. I made changes to the diet, and I've found that there are certain things that work for me and that don't work for me. And with my then dietitian hat on, I go, okay, why is this working for me, or why is this not working? But this coping mechanism of making dietary changes is something that can be done on a daily basis, because we control what goes into our mouth largely. And it means then that we've got a way of self-managing our disease, as well as also making us feel a lot better. So that created a bit of a sense of control. And for a number of people, it came up in these interviews that their quality of life really improved substantially, because they were feeling so much better from eating a lot of the time making better food choices as well. So it was really quite exciting. And some of the work that we've actually done at Wollongong has gone into some of those documents that are actually released by Multiple Sclerosis Research Australia, which you may have come across. What I'll do is later on, I'll pop them into the chat so you guys have got them available. And I think Kate can send across those links via email after the webinar is finished. But there are two different resources out there. One is for people with multiple sclerosis, and then one is for healthcare professionals who are supporting people with multiple sclerosis. And they're based on a lot of what we've been doing the research on in Wollongong, and looking at where is the strength of what's been published and where is the strength of the science. And it was really exciting to see that finally released in Australia, because it's quite a first for MS globally. I'll stop sharing my screen there, because you don't want to just see a whole bunch of screens the whole time. But yeah, hopefully that gave you a little bit of insight into what we've been doing at the moment in the MS space. And yeah, hopefully that's giving you a bit of a taster for the things that we're doing at Wollongong.
It's so interesting, Yasmine. Thank you for sharing that. So where to from here then with regards to your research? What's next on the horizon for you?
Oh, well, that was hot off the press. So we've of course moved on from that area, not moved on completely. We've shifted to the next part of what we're planning to do. And we've been very lucky to receive some funding. So IHMRI, we were successful with an IHMRI grant. So the Illawarra Health Medical Research Institute decided that one of our funding applications was worth funding. So what we'll be doing now is a local study in the Illawarra region, and we'll be looking at the idea of what we eat say about what our clinical symptoms are saying. So in terms of progress and progression with our multiple sclerosis, often that's measured through MRI. So we're going to use MRI measures and relate those to what we eat and see if there are any associations that we can find. So it's the beginning of a larger study, and hopefully we'll be able to find some more funding from other agencies along the way. But yeah, we're moving into a new space and looking into MRI records, which will be very exciting.
Does sound great. So when you say it's part of a larger study, this is you working alongside researchers at other institutes, or is that what that means?
Right. Yes. So we've teamed up with a few different organisations. So it's not just the University of Wollongong and the Illawarra Health Medical Research Institute working on this one. We've got a few researchers from up in Queensland, a few across in Sydney, and some then across in Newcastle as well, all helping out to make this project the best project that it can be, because there are some really interesting areas of expertise out there in terms of what we can do with MRI images. So in particular, there are some researchers on our team who will be looking at the size of the lesions that are seen on the MRI scans, and actually measuring the volume of those, which is not something that's normally done in clinical practice. But it'll give us really exciting insight into the progression of the disease, particularly between the first scan and the second scan in our project that we're doing.
So the first scan, and then followed up with some, so what will happen between the first scan and the second scan?
Business as usual.
Okay.
Yeah.
All right.
So continue your life as per usual, and then we'll follow up with you at the 6-month time point, and we'll say, okay, are you keen to come in for another MRI and see whether there's any difference. At the end of the study, of course, we'll provide you with some dietary advice in terms of what we've found from the assessments. But if we provided any advice earlier on, we would be intervening at that time point, and we wouldn't be able to see any differences or any associations that have happened across the time span.
Yeah. So it sounds like that's something that our community can get involved in.
Oh, that would be wonderful. Yes. Yes. So we definitely will be looking for people in the local area to join us on this project. It'll officially be starting recruitment, I'm hoping, in February if everything stays safe the way it is with COVID. But yes, early next year will be our MRI and diet study. So looking forward to that one.
Great. So if anybody is interested in getting involved, perhaps Yasmine, perhaps if you could share any information that you would like me to then share with our guests in the follow-up email that I'll send to everybody. They can then get in touch with you with any questions they might have.
No problem.
Great. And just on that, before we continue, Rebecca has asked a question. She wants to know how long will this new study go for, the IHMRI funded study?
It'll essentially be the 6 months. So
6 months.
You'll join the study and have your first scan at that time point, and we'll have dietitians who collect your information about what you're eating at that point in time as well. And then 6 months later, we'll do another scan and another assessment of diet to work out what you're eating, and that will be the completion of the study for this point in time.
Okay. And Emma has just popped up and said, it's a South Coast local enough? So in this case, Year of Adullah?
I guess it depends on whether you're willing to travel, because the MRIs do need to be at the same place, and our MRI scans are being done in Corrimal. So there might be a little bit of travel time there, but I guess, you know, I'm a traveller for my MS measurements the whole way along my diagnosis as well. So I travel all the way into Sydney and to various areas across New South Wales, really, to get scans and tests done. So I guess we're probably used to it as part of our disease journey.
Yeah. So Emma, I just recommend perhaps after this, if once you receive the follow-up email, perhaps just reach out to Yasmine and have a chat with her about that offline.
No problem at all.
So you mentioned you hope that this study will commence in February and go for 6 months. So obviously that's pending any COVID restrictions that may arise. Has COVID had any impact on your research at all?
It has, yes. So COVID put a complete halt on any clinical work that we were doing. And it meant that we were really needing to be a little bit creative on the way that we continue to do research if we were able to continue. And because as people with MS, we are at higher risk of various conditions, so we don't want to expose ourselves to anything more than we need to. We needed to be really careful about how we were going to do our recruitment for that study I just presented the results for. So that was originally a face-to-face study, and we were going to chat in person and have a nice conversation. So what we did is we moved that into Zoom and WebEx, and we tested the technology when we were also remote teaching children from home. So it was a very challenging time. But that was a big impact for us in terms of COVID. But yes, I did also mention we've had a few clinical studies that had to be stopped completely. Any areas where there was risk to the patient, of course, we had to make sure that there was the patient safety at the forefront of anything that we were doing.
Of course. So, and safety of the researchers in your team. Exactly.
Yes. So thankfully that's slowed down now. We're starting to see a few studies picking up again.
Right.
But yeah, we can just cross our fingers very tightly.
I think I might just jump to some questions that we've been getting through. Thank you everyone who's posted a question in the Q&A box. Please feel free, anyone that hasn't yet, or if you have already and you've got another question, just pop those in the Q&A box. Oh, there's one here from Jodie. I think this is relating just back to the study that you've been talking about. She just wants you to confirm, will you be looking at current or any older MRI scans, I guess, for a comparison, or will you be doing all the scans afresh? And how many people will you be doing this research with?
Sure. So in terms of the first part to the question, unfortunately, we can't look at any of the older MRI scans because you can't compare between different machines. And that's one of the reasons why we've set this project up as quite focused and within a particular time frame, because that way the funder can support people coming to the same centre on those 2 occasions. I would love to be able to look at older scans, but it would basically be one snapshot in time and doing an assessment of diet after the fact. We see a lot of factors coming into play as dietitians where we change what we say about what we ate. So we probably improve our reporting of what we ate by comparison to what we actually did eat. So unfortunately, no, we can't.
Okay.
But we're looking for about 15 people for the study. And it's just the beginning to test out the waters, make sure everything's established correctly. And then hopefully we'll go beyond this and engage a few more organisations where they have MRI facilities available for us that we can really use for research purposes. So particular machines that need to be available for us as well. So it's the high quality imaging that comes through.
Yeah. Gotcha. So I'm just going to jump to a question from Michelle. Michelle, thanks for sharing this with us. Michelle, I'm guessing you mean that you've been diagnosed with 16 years this year. You're 43 and a mum of 5 kids. Because of the impact that MS has had on your life, you haven't ever taken made any changes to your diet, in that the disease has already impacted your life so much. You didn't want it to then impact something else that you had control of. But you say that you're getting worse and worse every day, and now you're thinking about changing your diet. Where should Michelle start? How does she even start this process?
Yeah, and it's a very challenging space to be in. And thank you again, Michelle, for sharing your journey. What I would suggest is actually when we share those resources, I'm not sure whether you've seen the guides for people who have MS that have been released by Multiple Sclerosis Research Australia, but it actually goes through a number of different lifestyle factors. So there are 7 lifestyle factors that we've gone through and looked to see what are the recommendations for people that want to make changes, and where is the strength of the science that's out there. So we've got the areas of physical activity, diet, obviously, smoking, weight control, all of those different areas that are all on our list of lifestyle management factors that we can gain control of and we can do something about. So my suggestion would be to have a bit of a look over those and see which ones ring a bell, which ones do you think you could possibly change and keep that change in the long term. So don't make big changes, because it's less likely that you'll keep that behaviour change in the long run, particularly if you've got 5 kids. I've only got 3 and there's a handful enough here. But yes, in terms of diet, then think about what would you be willing to change and what are you aware of that needs change. And it's more likely that if you can identify ones that you're willing to change rather than someone telling you what to change, then you'll be more successful in that space. And it's a hard journey. It really is. And I've been on that journey. As I was saying, I did make some changes to diet, but that was relatively straightforward for me because it's what I do. But for me, physical activity was a tricky one because I'm not naturally sporty. It's not something that comes naturally to me. So I had to really make some very careful decisions about what I was planning to do there. And what I actually ended up doing was, my excuse was always, I don't have time. And I decided one day that I don't have time can't be my excuse anymore, because me not having time means I'm putting myself at the end. I'm not looking after myself as that person, that's that first priority. And I ended up finding a time in my day where I knew I always had some, sit down time. It was only like 5 minutes, but I thought, okay, this is it. I'll start with 5 minutes. And I ended up finding a secondhand rower, and I got that rower out, and every day I did my 5 minutes. I had my alarm on my phone, so it went off at me. So I went, nope, here's my reminder, got to do it now. And I slugged on through, and I'm now doing half an hour of rowing every day. But it took me 2.5 years to get to that point. So it's not a quick journey at all, but I feel the difference now if I stop doing it. So that's my recommendation, is find something, make the changes slowly, and then stick with it if you can. If you make a mistake and you slip, that's okay. Pick it back up again. We're human. We're not going to, be able to do everything at once.
That's great advice, Yasmine. Thank you. Marie wants to know, and thanks again, Marie, for your question. And I'm assuming this comes down to diet or possibly a symptom of MS, but she says that she says, hi team, constipation is a really big issue. Have you got any ideas on how to improve this situation?
Yep, I've heard that one before, definitely. So in terms of constipation, and then the other end of that one of diarrhea, they can happen in MS in relation to some of the medications in particular. But even if it's not MS related, my recommendation would be to see and have a bit of a think about how much you're eating in terms of fruits and vegetables, whether you can maybe up that a little bit more. So making sure you've got lots of fiber coming into your day, but making also sure that you drink enough water and stay a little bit active as well. So all of those factors together actually help to reduce symptoms of constipation. And again, don't make big changes because that can actually cause an upset tummy, but progressively start to add more fiber into your day. And, you know, it might be that you prefer to eat a particular type of bread and you know that it's maybe not the highest in fiber. So having a look at some of the other fiber choices that are out there on the shelf at the supermarket, having a read of the labels to see which ones have got a little bit more in them, and that might help you along the way. But if that doesn't work for you and that doesn't fit into what you tend to eat, even sprinkling some things like flaxseed on cereals in the morning if you're a cereal eater, things that are relatively easy to do, but they actually have quite a lot of fibre in them that can help you as well.
Great. Thanks, Yasmine. So on that, I guess there's lots of, because it's a bit old news now, but things like people being lactose intolerant or gluten intolerant. Sarah wants to know what your thoughts are on food sensitivity tests.
I think there's definitely a space for food sensitivity testing, particularly if you feel that there is something that is always having a reaction for you. So again, I've got a bit of a personal story there, not for myself, but my brother. So he's lactose intolerant and for many years tried to resist that because, of course, cheese was one of his favourite foods, and we know there's a bit of lactose in cheese. So it took him a long while to come to the realisation that maybe he should get it checked out because some of the symptoms weren't too nice to live with. But in the end, he did get the testing done, but he had to go on the advice that I told him to go with a credible testing centre. So there are some less than credible health professionals out there, and there are some less than credible tests out there. So making sure you have a look at the tests that you're getting done and making sure that you go to an appropriate centre. And there are some really good ones across Australia that are really well accredited and also provide some very good support services, particularly if there is then a food sensitivity. You might need to be referred on to a dietitian for that.
So how do people, how do they know whether they're in a reputable place? You mentioned about accreditation. Is there a particular stamp or accreditation that people should look out for?
Yeah, I guess that comes back to, from my point of view, the difference between dietitians and nutritionists, because there is quite a big difference. If you're looking for something like food sensitivities and allergies, definitely make sure that the person that you're talking to is a dietitian, and probably more so an accredited practicing dietitian, which means they're part of Dietitians Australia. That shows that that person actually has to every year renew their information, their knowledge about nutrition and diet. There are some less than credible organisations out there that give you basically a 2-week rundown of here is nutrition, now you're qualified as a nutritionist, right. And that's not what you want to be seeing. That's quite risky, particularly if there is a food allergy.
So would a recommendation be to go on to the Dietitian Australia website? Would all of the accredited dietitians be listed there?
They are, definitely, yes. There's a Find a Dietitian portal on the website. So it should be a quick Google search, and that should come up for you, hopefully, as one of the top links.
Great, thank you. And thanks for the question. What do we have next? There's one here about a particular diet, and I know you didn't want to mention a particular one, but Rebecca would like to know what your thoughts are on the Overcoming Multiple Sclerosis diet by Professor George Jelinek, I think it is. Do you have anything that you'd like to share on that particular diet?
I guess the premise behind some of these diets is all well-intentioned. So George is also someone who has multiple sclerosis himself, and he had done the same thing as many of you probably have yourselves, and he'd made some changes to his lifestyle, some changes to what he eats, and as a result, some of that flowed on to form the OMS diet. And while the general idea of the diet is reasonably sound, there are some parts where I don't personally, as a dietitian or as even a person with MS, agree with it. So in particular, there are whole food groups that are cut out and not recommended in terms of being consumed. And that for me is a red flag. So I personally don't feel that you need to cut out whole food groups unless it's for a cultural belief or something along those lines. If it's for the purposes of managing your diet and trying to be healthy, the best advice we can actually provide at the moment is to follow the Australian Dietary Guidelines. So they've been developed for people with chronic, to reduce chronic disease risk. And until we have something clear and in the space of nutrition for MS specifically, which I'm working on, give me a little bit of time. But until we have something there, I think that's probably the safest option to go for. So go for things like your, 2 and 5 fruit and veggies, your intakes of breads and cereals, mainly whole grain options, plenty of water, lean meat choices, all of those things. And of course, then your dairy in there as well, which I know is often omitted from some of the MS diets.
Now, I guess, let me just bear with me one moment. Jodie asked a question around managing MS just with diet and lifestyle choices as a preference to taking any recommended medication. Would you advise on doing this, or do you have any thoughts on that idea?
I can talk to this personally because I thought I could do this. And
right.
I'm trained in nutrition, and between having my second and third child, I thought, I've got these. I can do it all with diet. I don't need to go back onto these medications, because back then I was on medication that I had to inject, and I'm not a fan of needles at the best of times. Mm-hmm. So self-injecting was still up there on the fear factor list. Plus also I had 2 young toddlers at home. So I just didn't like the idea of them potentially getting a hand of my medication and poking themselves with a needle or anything like that. So I gave it a try. I wasn't doing it all properly, I don't believe, because I wasn't exercising. So that story I mentioned before about exercise was a recent one. I'm now very focused on what I do in terms of that side too. But I was trying to do things with diet, and then the stress of having 2 toddlers running around at home resulted in quite a substantial relapse for me. So it's not something I would recommend. Now, having moved on to a different medication, it is like a cloud has been lifted off me. It's amazing. It's like I had fog over me for the last, 10 years prior to studying the medication. So I would recommend having dietary and lifestyle changes in conjunction with any medication that your neurologist recommends, because they really are there to make sure that your disease is at its best state that it can be, and to slow the progression as much as possible. And then adding on a factor like changing lifestyle that you can control yourself can just help with that factor as well. So I wouldn't do it on its own, no.
Okay. From a dietitian. There we are.
From a dietitian, and also from personal experience.
Yeah. And in terms of working alongside and with your neurologist, are there any studies or any, associations or groups who are working to educate or provide education to neurologists on diet recommendations, so that the neurologist can give this advice to their patients?
So this is something that's on my to-do list in terms of my research journey, and I would love to be successful with funding for this area. But basically, looking at what the health professionals are saying, many don't feel equipped to be able to talk about nutrition and diet in particular. So what, as a dietitian, I would like to see there is neurologists referring on and making contact with people who do understand the space, because their time is very precious and they are extremely busy people. But also the idea of training them a little bit in the space is on my list of things to do. So that research, the other part of the research I presented to you guys was talking to the healthcare professionals, and we didn't manage to have a neurologist involved in the research, but from the people we spoke with, there was an interest in nutrition, but there was also a fear of talking to people who have MS about nutrition for various reasons. So that's on my to-do list of things that I would love to achieve, and love to create a bit of a training program for people who are non-nutrition trained health professionals.
Yeah, great. Interestingly, Angela has said that her neurologist has recommended the keto diet to her for weight loss, but I'm assuming as well, Angela, to help with your MS symptoms. Do you have any thoughts on specific diets in terms of helping your symptoms?
Yeah. So again, this is the way it's phrased already. It's the keto diet. So for me, that's a little bit of a concern. But my recommendation would be actually see if your neurologist can refer you onto a dietitian or self-refer yourself, because if you're looking to manage your weight, I think that's a very important factor, because weight actually adds to the inflammation in our bodies. Or excess weight adds to inflammation in our bodies. So the more we can do to reduce our body weight down to a healthy weight is actually better for us. And from that perspective also, I think if you work with someone who understands the space and knows the appropriate ways to lose weight in the long term, that'll be the most beneficial for you there, Angela. So I would see if you can see a dietitian about that, and I wouldn't rely on Google. It's a little bit scary.
Yeah, Dr. Google. And I guess the same, Debbie wants to know about fasting, the impact of fasting on MS. Same message there.
Very early days with fasting. So the literature and the research in that space is moving rapidly, but we haven't got much for MS specifically. So a lot of the fasting work is still in animal model studies. They haven't really moved clearly into the space of humans. And where they have moved into the space of humans, it's generally healthy people. So MS and fasting isn't an established area as yet. But again, what we'll be doing is working with Multiple Sclerosis Research Australia to keep reviewing those guidelines. So as things come through and as areas get stronger, we'll update you guys and make sure that those recommendations come through to you all.
Great, thanks, Yasmine. So there are lots more questions coming through about specific diets, and I think just to reiterate what Yasmine's been saying, that it's really about going on to the Dietitians Australia website, finding an accredited dietitian, and finding one that suits you. And if, for example, Marie has asked, is there a dietitian that specialises in MS? I would assume, Yasmine, to go onto that website and ask those questions, do a bit of research to find a dietitian that would be right for you. Would you agree?
That's right, yes. And to also have a look, because it will bring it down to regions as well. You may not be able to travel very far, and you can look at the regionally appropriate dietitians who are out there. I have to give you the heads up, there aren't many of us who are trained in MS in the dietetics world, so there may not be many, but at the same time, I do touch base with quite a few people, and I do provide advice to other dietitians. So you can always, let them know that I can have a chat with them as well. It's quite easily done.
And I guess nowadays, thanks to COVID, you could say, people are much more comfortable with virtual meetings such as we're doing right now. So even if regionally they're not close to you, they may well be open to doing a consult virtually,
exactly.
if that works for you.
Yes, exactly.
Okay, so I'm just going to move on a little bit from diet specifics, just to find out a little bit more about you, Yasmine, if that's okay. So what can you tell us a little bit about your job as a scientist? What do you find particularly satisfying as a researcher, and also what do you find a little bit frustrating, if anything? Oh, Yasmine, you've just frozen. Just give Yasmine a little bit of time. Oh, there she is. Are you back with us, Yasmine? Oh, I just can't hear you.
There we go. Is that better?
That's better. Perfect. You're back with us. Did you hear the question?
I did hear the question. I was just saying it's a very good question. So in terms of the most satisfying, there are a few different areas that are most satisfying in terms of research and working as a scientist, but the one that really hits the nail at the moment, and it's probably because of the time we are at in terms of the session on campus and teaching and so forth, is that journey of seeing a student at the beginning of their research. And it might be that they're doing an honours project and they're trying to find their feet, or maybe they've decided to jump in and do a PhD, and watching them grow throughout that entire project. And I've actually got a PhD student submitting today, and I'm really excited about that. She's been with me for over 4 years, and just that excitement of seeing where she had come to at the very beginning, where she's progressed, and all the amazing awards she's won. And it's just...
Oh, we'll just give Yasmine a couple of minutes. I'm sure she'll be back online with us shortly. Let me just. Sorry, just sit tight, everyone. Hopefully, she'll be back with us soon. She might need to turn her video. Yasmine, if you can hear.
Can you see me?
Yes, perfect.
Oh, I had turned my video off in hope that it would keep the connection, but it obviously lost the connection completely.
If we're worried about the connection going, it might be worth, I know it's not ideal, but it may be worth turning your video off and just having.
I had done that.
Yeah, okay.
Yeah.
So,
sorry, I missed which part would have had you last heard from what I was explaining.
About your PhD student submitting today and the progress that he or she has made.
Yeah, so I was basically saying in terms of the most satisfying component of my job there, and I think really seeing that journey of someone growing over time and all the different learnings that they've got and all the different achievements that they have over time, it's just really satisfying for me. I mean, yes, it's exciting to be successful with funding applications, but it's nothing by comparison, particularly when they're long-term students that you've worked with for a number of years.
Yeah. Oh, that's great. That's great.
And I guess the most frustrating would have to be the opposite. Yeah, it'd have to be not getting funding. So lots of rejections along the way. We learn to get a very thick skin as researchers, but hey, so be it. That's the way the area we're working in.
And for those of you who perhaps haven't who aren't aware, the funding space for researchers is just more and more difficult and challenging for them. The percentage of funding grants or grants that actually get funded is really quite small now. So I know as IHMRI is a not-for-profit, we're very lucky in that we get some great support from the community. So perhaps next year we'll look at doing some fundraising. So if anybody would like to get involved with that and assist Yasmine with her research, then please keep in touch with us. We really value the support from our community. And Yasmine, if you weren't a researcher, what do you think you'd be doing?
Oh, I think I'd still be in science. I'm a bit of a science nerd, so I think I'd probably be doing marine biology.
Wow.
I love being by the water, and I love being in the water and under the water. So the idea of exploring that and that being my focus, I think that would be really exciting. Either that or something in art, which is very different, but
science and art. Although I've seen it work. We've got a couple of our researchers have done a science degree and an art degree, and it's incredible how they actually do mirror each other and work together. So
we might do art therapy for MS in the future. Who knows?
There you go. There you go. I just want to ask whether we're coming up to Christmas. I'm sure that we're all guilty at some stage over the festive period of perhaps overindulging or not perhaps looking after ourselves in terms of physical activity as well as what we eat. Is there any advice you can give to people just to help them still enjoy the festive period but stay on track in terms of any of their health or physical activity goals?
Yeah. I mean, the idea of this break that's coming up for us a lot of the time is going to be just to relax. But also in terms of the food side of things, thinking about enjoying the foods that you eat. So many of us are hopping from one family to the next to get all those Christmas meals in. And do we really need to eat the entire meal each time? Probably not. So maybe going for your absolute favorite part of the meals that are offered at each family's house, and swapping some of the less than desirable options for better options, things that we know that we should be eating but we maybe don't do over the Christmas break, and maybe not having dessert at everyone's place because wow, you'll feel it afterwards and the next day and for a little while down the track as well. But I think more importantly, being mindful of what you eat. So actually tasting everything and really enjoying those flavors of the foods, and being thankful for the food that we've got as well. I mean, we've been through some challenging times this year, so it's really meant to be a time for us to enjoy and to sign off 2020 forever.
I think everyone's happy to do that.
Yes. But I think, yeah, don't be too hard on yourself, because it is meant to be a time of celebration, and food is all about celebration.
Yeah.
But have in the back of your mind, is this food the best choice I can make right now? And if it's not, then think, what else can I have?
Yeah. That's a really good message. I think a lot of the times especially in big family situations, you might eat mindlessly and not really be actually enjoying this delicious piece of Christmas pudding or pavlova or whatever it is that has taken your fancy. So really just sit down and really enjoy every single mouthful. And then in terms of staying active, which as we know can help with for everybody, perhaps just taking a walk with your family rather than sitting down watching the TV. Or
yeah, one of the things we love doing is, you know, when we've had, say, Christmas lunch or so, well, not necessarily lunch, dinner is probably a better example for this one, but going for a walk around and having a look at the Christmas lights, because there are so many exciting Christmas lights out there, and I'm seeing too many people now driving to see the Christmas lights. We don't need to do that by car. You know, we've got feet and legs and we should be able to use them. You know, obviously people who can't, different story, but I think where we can, go for a walk, take the family with you so everyone gets the benefit. You can have a chat along the way, and all of that's really good for your mental health as well. So making sure that you do stay a little bit active and not just sitting at the dinner table and the next dinner table and the next dinner table for the entire Christmas break. Yeah,
fantastic. Well, I think we're just about coming to the end of our time. So I just want to thank everybody who's dialed in today. Thank you so much for your engagement, for all of your questions. And Yasmine, thank you so much for all that really valuable information for us. If anybody would like to hear more, as I said, I'll be following up with an email as well as a recording of this webinar. So please get in touch with Yasmine if you're interested in any of the clinical trial, clinical study that Yasmine's doing, or the research project. And I'm sure if you had any specific questions that we weren't able to get to, I'm sure Yasmine would be happy to cover those off for you as well. IHMRI has got some really exciting things planned next year. So I urge you, if you haven't already, to sign up to our newsletter. It's an e-newsletter that I email out just once a month, and it covers any clinical trials that we might be doing, any upcoming events, and also focuses on some of the research that IHMRI does. We have researchers that work on a whole range of different diseases and research areas, from from diet to mental health to diabetes to dementia, cancer, kidney disease, a whole range of different areas. So I really would love you to sign up to that newsletter. Check out our website as well. It's ihmri.org.au, and under the news area, that's where you'll find the link to register for the newsletter. There is this very, very short survey at the end of the webinar that will pop up on your screen. If you do have 2 minutes, we really want to be continuing these webinars even after all the COVID restrictions lift and we're able to meet face to face again, because the feedback that we've got is that they're really valuable, but we obviously want to be putting out content that is interesting to you. So if you have any ideas of an area that you'd like us to cover, let me know, and we can make sure that we cover that. So look, thanks again to Yasmine. Really appreciate your time and all the information that you've given us today. And thanks again to everybody for dialing in. We really appreciate it.
Yes, thank you, everyone.
All right. Well, thanks, and enjoy everyone's weekend. Enjoy this lovely sunny weather. Thanks. Bye, everyone.
See you later.
Bye.